Welcome back. My guest is Dr. Dale Miles. He's a maxillofacial radiologist in Fountain Hills, Arizona, as we continue our discussion on cone beam CT. Dr. Miles, welcome. Now, when a dentist adopts cone beam CT, do they sort of need to retool their radiology skills?
Well, Scott, that's a great question. The manufacturers actually do a good job of teaching the staff and the doctor on how to use the equipment in the office, how to actually operate the cone beam machine and acquire the image. But, most of the information that the dentist is looking at comes with looking at the slice data. And yes, there are some retooling to do, if you want to call it that, because of all the anatomic planes of section, sagittal going side to side, frontal, front to back, and axial going head to toe. There's anatomy that we've never seen before. We've never seen a patient actually in the axial plane of section. So dentists have to really relearn some of their anatomy. And it's actually quite simple to do, because you can correlate those three planes of section when you find an anatomical structure, let's say the hyoid bone. You might see it in an axial plane of section first, and then it's quite simple to switch to another plane of section and confirm, one that they're more used to looking at, like the sagittal sort of view, or the side view, if you will. So anatomy is important. They have to spend some time. They have to find the resources to do that.
And can you now talk about some of those resources for dentists?
There are some anatomy applications that are available for download from the internet. There are textbooks, of course. I have a textbook that it's into its second edition, and it has a huge section on anatomy. There are courses, although I get questions all the time from dentists by email and in courses that I'm teaching that are not anatomically based, other radiology courses. I get the question, where can I find more information on anatomy? So there are manufacturers that are actually starting to put out experts to lecture to dentists and bring them up to speed on their anatomy. I've lectured at 3 or 4 large meetings and done anatomy workshops where we've actually had a hands-on manual. So I give them a short lecture. We go through the material in the planes of section, and then we go back over similar material where they fill in the blanks, if you will, in a manual, and when they leave, they actually have a resource that they can refer to.
And also, Dr. Miles, it appears likely that a dentist using cone beam CT would also see other pathology. Can you expand on that a little bit?
Right. I kind of, the other day, came up with the concept of what's reportable and what's, or discoverable, and what's referable. And they are going to see things in those anatomic planes of section that they need to refer. In the paranasal sinuses, in the airway, sometimes even in the cranial vault. So there are resources, again, out there that they can go to help them, discover when they need to refer.
All right, Dale, thank you so much.
Thank you.
My guest has been Dr. Dale Miles. He's a maxillofacial radiologist in Fountain Hills, Arizona. Thanks for watching.